Welcome, folks. Today we're discussing an interesting topic: Fibroblast Growth Factor 21, FGF21, resistance and its connection to metabolic dysfunction associated steatotic liver disease, or MASLD. MASLD, huh? I've heard that term floating around. What exactly is MASLD and why is it so important? Well, MASLD is essentially the most common cause of chronic liver disease worldwide. It's characterized by excess triglyceride storage in the liver, along with at least one cardiometabolic risk factor, such as obesity, dysglycemia, elevated triglycerides, low HDL cholesterol, or high blood pressure. Think of it as the liver's manifestation of metabolic syndrome. I see, so it's closely tied to overall metabolic health. And this FGF21 thing, what role does it play in all of this? FGF21 is a hepatokine, meaning it's a hormone produced by the liver. It has a wide range of effects on glucose and lipid metabolism, as well as hepatic insulin sensitivity. It's mainly produced in hepatocytes when triglycerides accumulate and PPARA is activated. Okay, so it sounds like FGF21 is generally a good thing, helping to regulate metabolism. But I get the sense there's a catch. Exactly. Here's the paradox. While FGF21 analogues, which are basically engineered versions of FGF21, are showing promise as therapies for MASLD by improving insulin sensitivity and reducing liver steatosis, higher endogenous or naturally produced FGF21 levels are actually associated with obesity, type 2 diabetes, and MASLD itself. That's counterintuitive. So, if these FGF21 analogs are helpful, why are high levels of the natural stuff linked to disease? That's where the concept of FGF21 resistance comes in. It's similar to insulin resistance. The body produces more FGF21 in response to metabolic stress, but the tissues become less responsive to its signals. So you have high levels, but they're not having the intended effect. Ah, I see. So the body is shouting louder, but nobody's listening. What causes this resistance? Several mechanisms have been proposed. Obesity and high fat diets can reduce the expression of FGFR1C and β-Klotho in adipose tissue, which are needed for FGF21 to work. Also, even with high FGF21 levels, the downstream signaling pathways like ERK1 or 2 phosphorylation can be impaired. Dietary factors like chronic low protein intake and inflammation can also interfere. So it's a complex issue with multiple factors contributing to the resistance. Is there any real world evidence to back this up? Yes, the editorial mentions data from the PREVEND cohort, a population based study. They found that participants with higher FGF21 concentrations consistently had higher BMI, larger waist circumference, elevated glucose and triglycerides, and lower HDL cholesterol. It's a metabolic profile that mirrors what we see with insulin resistance. Interesting. So, what are the implications of all this for treating MASLD with FGF21 analogs? Well, the authors raise some important questions. For example, will patients with high endogenous FGF21, presumably those with resistance, benefit as much from analog therapy as those with lower levels? Should the dosing of these analogs be adjusted based on the degree of FGF21 resistance? And could other drugs that increase FGF21 sensitivity enhance the effectiveness of the analogs? Those are definitely crucial questions to consider. It sounds like we need to be smarter about how we use these FGF21 analogs. Exactly. The editorial concludes that future research should focus on FGF21 stratification, identifying which patients are most likely to benefit from these drugs based on their FGF21 levels and degree of resistance. Addressing FGF21 resistance is key to unlocking the full therapeutic potential of FGF21 analogs in MASLD. Got it. So it's not just about throwing more FGF21 at the problem, but understanding how the body's responding to it. Thanks for clarifying all of that. You're welcome. It's a complex but important area of research. Hopefully, future studies will provide more answers and lead to more effective treatments for MASLD. Thanks for listening, folks. Until next time.